My name is Dylan Crail. I'm a student physical therapist assistant at CBD College, and I'll be conducting your patient education on venous ulcers. Now, what are venous ulcers? Venous ulcers are also known as stasis ulcers, as well as venous hypertension. And this is due to what's known as chronic venous insufficiency. Now, what is chronic venous insufficiency? It's basically the lack of blood flow into the veins. As your heart pumps through the arteries into the veins and returns to the heart, there's a block somewhere that causes a lack of blood flow to the veins. This creates these ulcers, or basically wounds that are basically holes through your veins and through your skin, and creates what kind of look like burn wounds, or pressure wounds, but are due to lack of blood flow. Now, the causes of venous insufficiency are unknown. However, there's studies that are suggesting that it can come from endothelial cell dysfunction, white blood cell dysfunction, edema, as well as lymphatic congestion. Risk factors, stuff that we can modify to try to avoid the development of venous ulcers, is sedentary lifestyle. This would mean lack of exercise, just kind of sitting around. If you have like an office job and you're not really moving around so much, that can contribute to that. Obesity is another factor that can contribute to that. Now, some non-modifiable risks that we can't control that can contribute to this would be age. As you get older, body tends to break down a little easier. Also, if you have family history of DVT, or yourself have past history of DVT, deep vein thrombosis, that makes you more prone. And touching more on family history, if you have a hereditary past of venous ulcers, that also makes you more prone. Next, I will break down 2 interventions that I feel can help either treat chronic venous insufficiency leading to the venous ulcers, as well as prevention in general. So, the first one will be compression therapy, and this is the gold standard. Customized garments or bandages that are suggested by the MD can help reverse this, or at least prevent it. This keeps your legs constricted and your peripheral veins constricted, and kind of keeping blood flow moving back upwards towards the heart. It's kind of like how muscle contractions help with blood flow return to the heart. That assisted contraction from the bandages or garments help. Now, a red flag to this that we want to take into consideration is if you also have arterial ulcers or arterial insufficiency. So, and if this is the more severe case, meaning if your venous insufficiencies and venous ulcers are more of the major concern, we can do some, variety training. However, if your arteries are more of the direct concern, then we want to avoid compression, because compression has the opposite effect on the arteries as it would for veins. We want to avoid compression for arteries because we want the blood to reach down into the legs, which compression would actually kind of prevent. My next intervention would be gait training, which kind of ties into exercise. So gait training can do a variety of good things for the veins, period. So as we're walking, as we're ambulating, we're getting blood flow down to those veins, and we're forcing those muscles to contract. And contraction is what makes the world go round in the veins. So we can do that, which will also help range of motion. We also want to promote range of motion to help with venous ulcers, to keep that flexibility within the skin, within our muscles, to prevent atrophy there. Just helps in multiple ways. Also, we want to do ankle pumps if they're not ready. So if they're not really ambulating, if you're unable to ambulate, we want to do as much as possible as normally as possible. So ankle pumps can at least keep veins active, keep muscle contraction to a degree, and keep blood flowing to some degree. Doing all these things can help prevent all these risk factors that cause chronic venous insufficiency and venous ulcers. So sedentary lifestyle, obesity, lack of activity, sitting down too much, gait training, ambulation, some sort of walking routine in general can help address all of that.